It is no secret that some of the largest hospitals in Minnesota are struggling financially right now. At the same time, our state's rural hospitals say they are too facing a funding crisis. And today they urged lawmakers to pass a bill they say that will keep their doors open. Danny Spiewak joins us now live from the Capitol with more on this. Danny?
Rena, rural hospital leaders were here at the Capitol today asking for more protections around a federal drug discount program that they say they really need to stay afloat, that makes them millions of dollars a year in revenue. It's a very complicated, highly complex topic, but it's an interesting debate and one that pits a couple of the really important and powerful policy groups at the Capitol against each other, the Minnesota Hospital Association and the pharmaceutical industry. At the entry point to the Boundary Waters in Ely, there's just one hospital.
We are a long, long drive from any other hospital.
In this tough financial climate, Ely Bloomington Community Hospital President Patty Banks says a federal program known as 340B provides a lifeline by allowing them to purchase drugs at a discounted price, then use the savings to sustain their hospital and pharmacy operations.
It's not just a federal program on a piece of paper. It is every prescription that we fill in our retail pharmacy.
In 2024, Minnesota Safety Net hospitals made more than $1 billion in revenue through the 340B program.
This is a program that is keeping hospitals open right now.
The Minnesota Hospital Association is urging lawmakers to pass a bill that would extend state protections for the 340B program and give the Attorney General enforcement power if drug companies aren't following the rules. Drug companies like the one that makes Humira testified against the bill, saying the 340B program has grown unsustainable and leads to higher costs for consumers.
Why is this? Because 340B hospitals and clinics make more money on Humira than biosimilars, creating a financial incentive for them to continue to prescribe the more expensive drug.
Despite the opposition, the Senate passed protections for the drug discount program earlier this session.
This is Minnesota, Minnesota hospitals, and Minnesotans standing against Big Pharma.
In the tied House, the bill got hung up over a dispute about whether the AG should enforce the program. But some Republicans now say they're willing to compromise.
This is too important to not get this passed. And so the original bill is what passed in the Senate, and that would have to be the bill that we use.
So for this to get to the governor's desk this session, this legislation on the House side would have to get into a conference committee, or Speaker Lisa Demuth could bring it to the floor for a vote. We're told by House GOP spokesperson that those discussions are ongoing. So it's certainly something that could happen on the House side. Again, it already passed the Senate. Back to you.
Danny, did those that were representing the rural hospitals say that this was happening in other states as well?
Yes, there's been various, legislative fixes in other states related to this 340B program. And the other thing is that, rural hospitals just across the country in general are really struggling. So they just say they desperately need this funding. And actually, we've talked a lot about HCMC. They also are part of this program and other nonprofit hospitals. So it would affect pretty much everybody.
All right, Danny, thank you.